more about different sort of categories of information that comes up on this one. So not a particular condition and the words that will come up, because we did that earlier, but also, you know, the categories that you've put words into. So I'll give you an example. One of the categories might be names of conditions. So things like sepsis, bronchitis, celiac disease, leukemia, these are all names of conditions, and that's one category of specialist terminology you might need, if that makes sense. Sherry, can you think of any other categories of terminology that you might want to get to know?
I think like what kind of test they need to kind of have or run because of this like specific conditions, or blood test or thyroid some test, ECG, something like that.
Yeah, you're absolutely right, Sherry. Yeah, so names of I'd probably put it into an even broader category of procedures and treatments. Is certainly one category of specialist terminology you might need to use, because again, doctors, you know, they try and make it as simple as possible, but sometimes it helps them to use a specialist term as well, because it helps people understand what they're talking about, rather than just giving a rough explanation of what it is that they need. So appendectomy, for example, is a procedure that someone might go through. Okay, so that's a good
Never
example.
heard.
You never heard of it? When you have your
No.
when you have your appendix out, I believe. I've still got.
Okay.
You'll have to check on that. That can be your research. Homework assignment number 1. Find out what apectomy means. Appendectomy, sorry. I can't even read it myself. There we go.
Can I ask a question quickly?
Of course you can.
You know, like lots of medical sicknesses go like shortcuts. It's just capital letters of every word. Do we need to learn this as well? Because
it's funny you say that, because that is one of the categories of specialisms is abbreviations, and abbreviations we seem to like them anyway in the UK. You know, there's any kind of work you do or professional situation, there's always heaps and heaps and heaps of abbreviations for things, departments, people, procedures. We seem to love abbreviations and acronyms. So yeah, and that's no different. I mean, people will talk about there are abbreviations within medical specialisms that I recognize the abbreviation and I know what they're talking about, but I couldn't tell you what the abbreviation stands for. So an example of that instantly stands out in my mind: a CAT scan. I know what a CAT scan is. I know what happens in one. I've seen it on TV and stuff. I've not been for one myself, so I kind of know about them. But if someone said, what does CAT stand for? No idea. So these are the kind of things that you'd want to maybe recognize and possibly look at what they mean as well. So yeah, it's a very good point.
Okay, I've just looked on Amazon, and you can get a booklet with all the listings.
Well, there we go then. So you could buy that. Again, remember, it can go out of date, but that could be a good starting point. But again, you'll find these kind of abbreviations in dictionaries and glossaries as well. So what are the categories? So we've had names of conditions, we've had names of procedures and treatments. What other categories do we think there might be? Amelia, can you think of any other categories?
What about how intensive, how strong the diseases or the illness, like acute, chronic, and stuff like that?
Yes, so severity, I guess that would be. So it's learning, because they do use certain words to describe that, don't they, within medical situations that you wouldn't really use outside of medical situation. So that would be a good idea as well.
Or the words of like treatments.
Yeah,
chemotherapy,
absolutely.
Physiotherapy, radiotherapy, all these words for the treatment names.
Yeah, absolutely. Good stuff. Can anyone think of any other categories? It's getting quite difficult now because we've had most of them. But
it's like basic symptoms.
Did you say, sorry, basic symptoms?
Symptoms, yeah, like dizziness, nausea, sort of thing.
Absolutely, yeah. And symptoms are something that certainly every time I've been to a GP appointment, symptoms are discussed. So yeah, I would certainly get familiar with the different kind of symptoms. Any others?
Can you please explain this again? The name of test and the abbreviation, what does it mean?
So the different types of tests that someone could have when they go to an appointment. So a doctor will send people for tests. So they might say, and the example I gave there was a CAT scan. So they might say, right, I'm going to have to send you for a CAT scan. and that's your follow-up appointment. So getting used to some of the names of those tests and the abbreviations that are used. So other ones could be CTG, cardiotograph. I can't even say it. Cardiotography. I can't say it literally. CBC, complete blood count. So I've got some examples written down because I can't think of them on the spot. Ultrasound AFP, alpha fetoprotein, biopsies. So all of these kind of things might come up in assignments. So again, don't try and instantly revise them all because there'll be too many and you'll just get disheartened. But certainly when it's related to an appointment type, it'd be worth doing.
And the doctor would say it in a easier way so we can translate to the customer, right? To the patient, pretty much.
Sometimes they do, but some of these abbreviations are so commonplace they would just use it and they'd wait for a question rather than explaining it first time. Flo, you've got a point?
Yeah, if I don't really remember the name of the abbreviations, or can I ask the doctor, what's that meaning? Because
exactly, yeah, you can do, and as long as you're not doing it all the time, then generally a doctor will understand that you are not yourself a qualified doctor. I suppose there might be interpreters that are, but most interpreters aren't.
Obviously, I'm not going to ask them all the time, but it might be a point that I don't really know what it is, or the patient will ask, what is that?
Yeah, exactly. So well, the patient probably will a lot of the time. You will definitely get that, but certainly in terms of yourself, if you don't understand something, then definitely the doctor and the patient would much prefer you to clarify it and ask a question about it rather than try and guess at the wrong information. So yeah, that's in fact that's something, as you'll see when we do Unit 5, that's something that is considered part of the skill, is knowing when to ask questions if you don't understand it and having the courage to do so, because it can be quite difficult. You know, you will be seen as a patient, by the patient, I should say, as an expert as well as the doctor. So it can take courage sometimes to ask a question and maybe appear like.
Well, let's not forget that we are not doctors. We're just there to facilitate a conversation between doctor and patient.
Yeah, precisely. So that, but it's. I mean, I have seen situations where an interpreter hasn't asked a question when they probably should. Well, they definitely should have done. And one of the reasons might be just because out of pride they didn't want to look like they didn't understand it. So, but of course, in an interpreting situation, your role is to be as accurate as possible and to interpret the meaning. So if you don't understand something, then yeah, the right thing to do is ask a question about it. Good point.
Okay, thank you.
You're welcome. So yeah, so other things, categories of things, names of hospital departments and their abbreviations. So a GP appointment, for example, the practitioner might say, I'm going to send you to A&E, or I'm going to send you to cardiology, or gastroenterology, or neurology, or oncology, or all these different names with ology at the end of them. Names of doctors' specialisms. So again, they will refer to different specialisms by their name: podiatrist, general practitioner, pulmonologist, urologists, things like that. Radiographers. Names of procedures and treatments, which we talked about as well. So you might get things like a cesarean section, appendectomy, which I mentioned earlier, mastectomy. So all of these different procedures, even though they are medical terminology or specialist terminology, a lot of them are in common use really within people. So the doctors still will use them to a certain extent.